Dr. John Torres here with NBC News. Dr. John, as they call me, giving you this Facebook Live where I talk about the headlines that have occurred over the last few days, particularly over this last week. Get behind the headlines to give you a better understanding of, number one, what that means, but also, number two, what it specifically means for you, and hopefully some take-home tips that can help you get better prepared, get a better understanding of the pandemic, coronavirus, COVID-19, and what you can do to keep you, yourself, your loved ones, and your community as safe as possible as we work our way through this pandemic. And we will get through this pandemic. It's just a matter of how long it's going to take to get there and get through it. So everybody, the main point, being patient, being vigilant, and doing those things we know that we need to do. Number one, today is September 11th. It was also 6 months from time period when the World Health Organization, the WHO, actually declared this a pandemic. It was March 11th. If you go back to that time frame, if you remember, around February, especially late February time frame, there was a lot of pressure being put on the World Health Organization to declare this a pandemic. Up to that point, they hadn't, because it really hadn't met their criteria or their definition from the pandemic. But if you fast forward 6 months to now, September 11th, it is showing just how explosive this pandemic has been over the past 6, 7, 8 months. Put it in perspective, when they declared this a pandemic, there were 118,000 cases of coronavirus around the world. That's what they did to declare it. Now fast forward to now, September 11th, and what we're talking about is right now we have 28 million cases around the world of coronavirus. We have almost 1 million deaths from coronavirus, 911,000 deaths of coronavirus itself. Here in the U.S., 190,000 deaths, and we have, as of the last count by NBC, over 6.4 million coronavirus cases here. So that shows you, going from March 118,000 all the way fast forward now to 28 million, how explosive this is. And actually, Dr. Fauci brought up a good point when he was asked about this. He said, we cannot take any pandemic lightly, and particularly this one. And he said, let's relate this, not necessarily how it's affecting people or what's going on as far as the explosive growth of it, but looking back at the HIV pandemic. When the HIV pandemic was first seen, when we first heard about this virus, it affected a few people. A couple months later, affected around 10 people. Well, over the decades, tens of millions of people have unfortunately died from HIV. It's showing you just how these pandemics can progress over time if we don't do what we need to do to keep them under control. Here with the coronavirus pandemic, we're seeing this growth. We're seeing the growth continuing on here over the next few months, possibly next year or so, until we get it better under control. So again, the things we need to do and the things we've learned over the past 6 months are things that work. Sure, early on, there was a lot of emphasis said, okay, a lot of experts were saying, we don't necessarily need to use masks. We don't think they're going to work that well, because nobody really understood how this spread, and especially the asymptomatic spread of coronavirus. That was the change here that started having all the experts, myself included, switch from we don't necessarily need masks to we better wear masks as much as we can, make sure you social distance, do those things that we need to do to keep safe. Over the past 6 months, we've also learned about treatment. Hydroxychloroquine doesn't work like we thought it would. The convalescent plasma doesn't seem to be working as well as we'd like it to. Remdesivir seems to help a little bit, but it's not the lifesaver we thought it might be, at least at this point. Steroids, dexamethasone, an old steroid that's been around for a while. That's the one medicine that's been proven to be life-saving in certain situations where people are critically ill. And so we're learning more about the treatments. We're even learning treatments as far as, okay, let's not put them on ventilators quite as quickly as we used to, because we used to put, as physicians, if somebody came in with an oxygen level of 85%, they went on a ventilator right away because we were trying to make sure they got enough oxygen. Now we know with coronavirus, it's okay to have that oxygen level that low because they're hopefully going to recover from it. And putting them on a ventilator too early can actually cause more harm than good. So we learned about ventilators. We learned about placement, putting them prone, putting them stomach down to help them breathe better. That can help. Just simple things like that. Things we didn't know 6 or 7 months ago. But again, this is kind of an ignoble 6-month time period. The fact that the cases have exploded, we're still trying to keep this under control. And you can see outbreaks in different parts of the world. Even here in the U.S., things are getting better, but we still need to get things better under control. And we're waiting for that next surge to come wintertime with the cold weather. So that's number one. Number two, Dr. Fauci, alluding to that, is actually saying we all need to hunker down for the fall because a couple of things are going to happen. One, the flu is going to be showing up. And so the flu, the symptoms of the flu initially look just like the symptoms of COVID-19. And so there's going to be a lot of confusion there. A lot of people going to the hospitals thinking they might have COVID-19 when in fact they have the flu, or vice versa, overwhelming the hospitals. A repeat of what happened in March and April, where hospitals were just inundated in certain areas. Don't want that to happen. So what he's saying is, part of the hunkering down, get your flu vaccine. Now's a great time to get it. Go ahead and make sure you get that. So that can help you, even if it doesn't prevent the flu, can help you from getting complications from the flu, can help you prevent you from dying from the flu. That's what the flu virus is really good at doing. So getting that can certainly help you and your family, and also help you fight off COVID-19 if you happen to get that at that point. Now, so again, he's saying, come the fall, we can't let our guard down. We need to hunker down. We need to double down on doing those things. Wearing masks, watching your distance, washing your hands, opening windows when it's not too cold outside to get that air ventilated, especially if you're in a place outside of your own home, to make sure that you do ventilate the area you're in to try and dilute out the virus and not spread it as much. And then the last one we talk about is actually yesterday I did a Facebook Live. It's a series I call Doc to Doc, where I talked to Dr. Francis Collin, the head of the NIH, talking specifically about vaccines and distributions. And what he said was that he thinks by the end of the year, one of the 6 main vaccines they're looking at right now, he thinks one of them by the end of the year will probably be a vaccine that can go for emergency use authorization. Might even start to be used at that point. But remember, the National Academy of Sciences came out with their phased distribution program. Phase 1, healthcare workers who are directly taking care of coronavirus patients, those who are elderly and those with pre-existing medical conditions that could put them at that critical list of having complications from coronavirus. And then phase 2, 3, and 4 goes down the line as to who gets it at what point. So the fact that we have one at the end of the year possibly means that those phase 1 people will probably be getting it at the end of the year if we have that one vaccine. But the other thing we found out this week, AstraZeneca, one of the leaders in the race for the vaccine, who's now in phase 3 trials, had to halt their phase 3 trials because they had one patient who came down with a condition called transverse myelitis that could or could not have been because of the vaccine. But in cases like this, and this is very common in clinical trials, they halt the whole trial to make sure nobody else has any issues with it. They investigate to find out if it's from this one, if it's from the vaccine, or if it's something the patient would have gotten even if they had not gotten the vaccine. And they do that through independent researchers. So they're not, basically they don't have a horse in the race. They're not actually part of the trial itself, so they don't have that pressure put on them. Then they'll get some information, then they'll restart the trial. But what this shows, and this is what Dr. Collins talked about, is the fact that, number one, they're taking safety very seriously, so they're halting the trial if they find anything, but also shows that this information, these issues that have been going on in clinical trials since clinical trials started decades and decades ago, are things we typically don't hear about. But now there's so much media attention on the vaccine trials, we hear about them. But what he thinks, and I agree with him, that hopefully this gives people some confidence. Like, yes, these manufacturing companies, the FDA, they're taking this very seriously, the safety, to the point where they're willing to slow down the vaccine development to make sure it's safe. So that's the important part there. The other thing he said is one of the things that's slowing down the development, and that's why we might only have one at the end of the year, it might not even be till next year, is they're trying to recruit more minorities into the clinical trials, and that's an issue they're having for very good reasons. In past, history has shown us that those groups, the ethnic groups, have had issues with medical systems, and so that trust isn't necessarily there. So they're trying to do what they can to rebuild that trust, to get them into the systems here and into these clinical trials, so we can have a better understanding of how it affects a cross-section of people, be it age, be it ethnicity, be it prior medical conditions, because that's what's going to happen in the general public. And then on top of that, he said distribution is going to be an issue, and they're working on that right now. And part of the distribution is not just the vaccine. Part of the issue with the vaccine is some of these are what we call ultra-low cold storage vaccines. And so the vaccine has to be stored at minus 60, minus 80 degrees centigrade. That's very cold. And doing that means that you have to be very careful when you ship it. And so that's going to be difficult to get that, but they're trying to get that under control now. On top of that, they're looking at syringes, needles, alcohol swabs just to clean the area, just those simple things that we don't typically think about. They're trying to get all that under control now, so when the vaccine does come out, it gets that authorization, they can start using it, they can distribute it to where they need to. But again, looking at the 3 different headlines, one, this is the 6th month anniversary of the World Health Organization declaring the pandemic. Not an anniversary we wanted to actually look at, but unfortunately things have gotten much, much worse than they were back in March 11th. However, things are getting a little better under control now, but there's the opportunity for them to go right back to where we were before, to the bad outbreaks around the country and around the world. And that's why Dr. Fauci, which is the second headline, is saying we need to hunker down. Can't let our guard down. We need to do those things we need to do in order to keep us, our loved ones, our community, our families all safe. And then with my Doc to Doc series on Facebook Live with Dr. Collins talking about the vaccine, its production, its distribution, and the fact that they're looking for minorities to get involved in these clinical trials so they can get a better understanding of how it affects all of us before they start distributing it. Let me see now if you have any questions.
Once you've tested positive for COVID-19, what does it change? Does it change, or is there a chance you'll get it again?
So, and I get this question a bit. Once you test positive for COVID-19, can you get it again? Does it change anything? Well, first let me talk about the change anything perspective. No, it changes absolutely nothing. The 4 W's we keep talking about. Wear a mask, watch your distance, wash your hands, open windows. Those 4 W's, whether or not you've had COVID-19 or recovered from it or haven't, you still need to practice those. Here's the reason why. Because we don't know, number one, if you have COVID-19, have you built up antibodies after that? Have you built up sufficient antibodies to fight it off again? Can you get it a second time? We used to think, no, maybe not, but then we have these 4 cases of people getting reinfected around the world. Doesn't mean everybody's going to get reinfected like we talked about. There are 28 million cases, 4 have gotten reinfected. To put it in perspective, it's very, very, very rare that happens, but it could happen. We need to make sure everybody's safe. The other thing is, it's hard to tell who has COVID-19, who doesn't have COVID-19, who had it in the past, who never had it, who doesn't have antibodies or resistance to it. So having everybody wear it certainly helps protect everybody else. And that way people aren't getting signals out there. So now, as far as can you get it a second time, again, out of 28 million cases in the U.S., we have 4 cases of people verified having gotten reinfected. Very, very, very rare. And in these cases, they noticed that the virus changed to the point where they could get reinfected. But in one of the cases, actually, the person had an immune system issue, so it gets very complicated. 2 of the cases, they actually had no symptoms or very mild symptoms, and so it looked like their resistance to COVID-19 from their prior infection helped fight off a second infection, or at least the complications from a second infection. One person, the third person actually got sicker, so again, it's very complicated, but it's very, very rare to begin with. So again, you need to protect yourself, you need to protect everybody else, because we're not exactly sure at this stage.
How soon should I get a flu shot? Is it safe now?
As far as getting a flu shot, go ahead and start right now. What I typically talk about is sometime around mid-September. You want to get it. You want to try and get it before Halloween. The American Academy of Pediatrics says for kids to make sure you get it before November, but November is when our flu season can typically kick in. And here's the deal with vaccines. Anytime you get a vaccine, particularly the flu vaccine, it takes about 2 weeks for your body to develop the immunities, your body to develop those antibodies to fight off the flu in this case. So you want to get it 2 weeks before the flu hits. What happens sometimes is people will wait until they find out that the flu is in their area, then they'll get the flu shot. And it's not really protecting them much at that point because it does take that 2 week time period. So you want to get it now, let's say mid-September. That way, by the beginning of October, you're as protected as that vaccine can give you protection for. And then if the flu comes around in November, you're again, as protected as the vaccine can do for you. As far as the vaccine protection, one of the things that people often talk about is, well, the vaccine's only 50% effective. That is true. The vaccine is around 50% effective at preventing you from getting the flu. However, the vaccine's main claim to fame is not preventing you from getting the flu. That's what we hope it does. But what it mainly does, it prevents you from getting complications from the flu. It prevents you from getting hospitalized from the flu. And it prevents you from dying from the flu at a much higher rate than people who are not vaccinated. And so I tell people all the time, if you look at it from that angle, and if you've ever had the flu, and being a doctor, it's not uncommon. I've had it a couple times. It is a bear. It is not something that you really want to have to deal with. And essentially what I tell my patients, if you're asking me, is this a flu or a cold? I'm pretty much going to tell you it's not the flu, because you know when it's the flu. You feel like all of a sudden you cannot get out of bed. You cannot move. It is just so bad. Well, the flu shot helps prevent it from getting to that point, at least as much as it can. So again, get the flu shot. Now is a great time, but definitely get it for you, your family members, anybody 6 months and above by the end of October.
Is it safe to get a flu shot after having COVID-19?
Is it safe to get a flu shot after having COVID-19? One of two different things here. One, if you actively have COVID-19, if you're sick right now, you really don't want to get any vaccine for a very good reason. The reason you don't want to get a vaccine is because your immune system's already tied up trying to fight off COVID. And so to try and get it to fight off COVID, and all of a sudden it's trying to develop an immunity to the vaccine that you just gave, and you just got, and so it's trying to develop immunity to the flu, that doesn't work so well. So you want to wait until your immune system isn't working that hard because you're not really infected with anything at this point, and then get the flu vaccine, because that gives your immune system the opportunity to fully concentrate on that vaccine, to build as many antibodies as they can to help fight off the flu. And that's why we tell people, if you have a fever, if you're having cold symptoms, if you're having any kind of symptoms like that of illnesses, then you want to wait until you recover from those before you get the vaccine, because you want the vaccine to do the best job it can at building those antibodies, building that immune resistance to the flu. But as far as if you had COVID-19 in the past and you've recovered, yes, you can and you should get the flu shot, because again, there is that issue of people getting reinfected with the virus. Again, only 4 cases out of 28 million, so it's very rare, but we want to make sure we don't get that confused with what could possibly be flu symptoms at the same time come this fall.
Will the coronavirus vaccine be yearly?
So will the coronavirus vaccine be yearly? The answer is we simply don't know, because as I talked about when I talked to Dr. Francis Collins yesterday, he thinks by the end of the year it's possible we could have one of the 6 vaccines that are in the lead being authorized to be able to be used, especially those in that phase 1 of distribution. But what we don't know is how well it's going to protect this, how many antibodies it's going to develop, and whether we need to get boosters or whether we need to get yearly shots based on the vaccine. And it could go a bunch of different ways. One, it could be like the flu shot where we have to get yearly vaccines. Number 2, it could be a shot that you have to get a booster every 10 years or so, kind of like tetanus. Or it could be one that you get one and you're done. You never have to get it again. What it depends on are a couple things. One, it depends on the vaccine itself and the development of the vaccine. So far in the trials, it's looking promising, like these vaccines are building up a strong immune response, which is good, and the type of immune response we want, including not just the IgG antibodies that we talk about, but also these things called T-cell antibodies, which are kind of the memory antibodies and the sentinel antibodies in the body that help the system detect and fight off coronavirus. So they're getting that strong response. But on top of that, it depends on what happens with the virus itself. And as I said earlier, it doesn't look like the virus is changing very much. It hasn't gone through any big mutations that have any of the virologists or any of the vaccine developers concerned about it changing so much that the vaccine doesn't work. That's why you have to get a flu shot every year, because the flu virus changes enough every year to whereas last year's vaccine won't work against this year's strain, because that's how much it changes. The coronavirus does not look like it's doing that, at least at this point, but time will tell. But that's a fantastic question. Hopefully, we either have one and done or one with a booster 5-10 years down the road. Not every year, but it's possible that it could be every yearly shot as well. The main point is getting that vaccine to help us get the pandemic under control. But like I talked about, thank you for your questions. Like I talked about, number 1, this is a 6-month anniversary of the World Health Organization declaring a pandemic. Still have a ways to go. We went from 118,000 cases on March 11th when they declared the pandemic to 28 million cases right now, 190 plus deaths here in the U.S. So you can see how it has just exploded over the past few months. Unfortunately, it keeps, here in the U.S., around 40,000 cases a day, around 1,000 deaths a day. So it keeps on going. And as Dr. Fauci said, which is the second part, in the fall it could get worse. We need to hunker down. We can't let our guard down. We still need to do those things we need to do in order to keep us and everybody else safe. And then number 3, the vaccine. I talked with Dr. Collins yesterday from the NIH, and he's saying, okay, we think we're going to have one possibly at the end of the year. Distribution's an issue. The phase 3 trials are getting slowed down a little bit because they're having trouble recruiting minorities that they want in the trials to make sure it works for the whole spectrum of society. And so those things are helping slow it down to a certain extent, and that's why it's probably not going to be October, November time frame. Might be December, January, February, or even later time frame. But number 1, thank you very much. I hope everybody has a fantastic weekend. And most important thing is please do what you need to do to protect yourself, your family, your loved ones, your community, And at the same time, try to stay happy and try to stay healthy.